All right. All right, good afternoon, everybody. Can you hear me okay? I'm hearing no. You can't hear me. All right, technology people. Can you hear me now? No. So.
People online can hear you.
Okay, but people in the room can't hear me. Is there a way to turn volume up on this? So as loud as it will go. Hate to try to. Can you hear me now? Nothing stops people from moving up closer in the room as well. So, all right, you're hearing me because you want to stay in the back. All right, I'm just going to talk loud. I'm Laura Howard, the Secretary for the Kansas Department for Aging and Disability Services, and I would welcome you to this stakeholder meeting. This is the second stakeholder meeting we've done this week. We had the opportunity to travel out to Greensburg, Kansas earlier this week for a stakeholder meeting, and also had a number of individuals online virtually at that meeting. Today as well, in addition to those of you in the room, we have I think 50 people who have joined us through Adobe Connect and others who have joined us through a conference call option. And I might just say a couple of logistical things. We do have 2 interpreters here at the meeting, and also for those of you who are on Adobe Connect, we are captioning the meeting, so I think if you can scroll further down your screen below the slides, you'll be able to see that captioning. So why are we here today? One, we're here because, one of the values that I really bring to this agency as secretary is just the importance of communicating together, sharing information that we have, and garnering input from really a wide array of stakeholders. Whether you're an individual who receives services from us, whether you're a provider, whether you're an advocate, wherever you fit within that stakeholder category, your voice is important to us, and making sure that we all really have the same information. This meeting is happening now really as a post-legislative session update, where we will share with you some updates on the KDAD's budget, as well as relevant legislation that passed in the last legislative session, some directives that have been given to us as an agency that inform some of our work over the next few months. But we also want to take some time today to share from our perspective some of our key program updates and really what are some of our key priorities across our various commissions. What are we spending our time working on? So we're going to do that today as well. You'll have some chance for questions along the way. We'll pause a couple times for questions about the budget, about legislation, about some of the directives that we've been given. And then also at the end, we want to give you a chance to react a bit to some of those priorities. You might say, gosh, this is a priority we think is really, really valuable. We're really glad you're spending time on this. Or you might say, gosh, I think something's missing from this list, and we'd really encourage you to prioritize that as you're thinking about your work over the coming months. I would note, and I'll say this again, we will have another opportunity for input later this summer in August that will be more directly tied to development and submission of the next budget that has to be submitted in the middle of September. So our purpose today isn't to garner recommendations for the next budget cycle. We're really more about what's happened in this legislative cycle, and then here, as this new administration has been in place for a few months, here are some of the key priorities we've identified, be able to get some reactions and input from you about those. So I'm going to start with just going through some of the KDAD's budget adjustments. We'll also have updates on budget changes as well within the state hospitals that we also have responsibility for. So I'm going to start with budget adjustments that were made in the current year budget that's just going to end in just a few days from now, a couple weeks from now. The first major budget adjustments, and the ones that happen every year in our budget, relate to caseload. There's a consensus caseload process in Kansas where members of the legislative research staff, the division of the budget, and state agencies come together and they agree on estimates for Medicaid programs and other human service entitlement programs, and also agree on expenditure estimates around the home and community-based services waivers. So in terms of caseload and waiver adjustments, those consensus processes happen twice a year, once in the fall, usually in November, once in the spring in April, and then the governor and legislature adopt those estimates almost all the time. It's been a really strong process in Kansas that I think has stopped some things from being maybe politicized over the years. So in terms of the caseloads for KDADs, you'll see in total the caseload adjustments in the current year added up to about $40 million in additional state general fund dollars across our programs. A couple of other changes in the current fiscal year. We also received about $150,000 to increase reimbursements for the CARE program. Those of you who work in this arena know that the CARE program is the program that provides individuals information on long-term care options and assists in determining appropriate placement. And the Aging and Disability Resource Centers perform most of those assessments, and some of those may be performed by hospital assessors. And this funding increases funding for both Level 1 assessments and for Level 2 assessments. Probably the most significant item in the current fiscal year relates to mental health crisis centers. And this is a little bit of a complicated item, so I want to spend a few minutes on this. A couple of years ago, the legislature dedicated funding from a new lottery opportunity towards community crisis centers. Unfortunately, there were some delays in getting that new lotto operation going. So crisis centers were beginning, folks doing work in Sedgwick County, here in Shawnee County, also crisis centers may be funded in some different ways in Salina and out in Pawnee. So this legislative session, in order to make up for that delay in funding from the lottery, the legislature added $2.3 million in state general fund revenue. Most of that for the crisis centers, some of that for clubhouse model programs. Additionally, there was funding approved for expansion of the clubhouse model as well to provide startup funding for some additional clubhouse programs. Based on the availability of some other funds in the KDAD's budget towards the end of the fiscal year, Governor Kelly actually vetoed that appropriation, saving those state general fund dollars. However, that action has no impact on funding and operation of those crisis centers. As an agency, we are using what we call Osawatomie State Hospital diversion funds. We never know till the end of the year exactly what funding we're going to have available from that funding source. And so we're able to use that funding to maintain those services in the current year and still provide some savings to the state's ending balance. So again, a little bit confusing. You may have questions about that when we get to the question period, but I think my point in that would just be that no impact in terms of provision of funding to those centers, and in fact, those contracts have been executed and out the door. So, as we move into 2020, the fiscal year that starts in a couple weeks, the first major item is, of course, the caseload and waiver adjustments. Really what happened in that consensus process. And as you look at the handout in front of you, again, you'll see increases in the fiscal year 20 budget that total. Again, just about $50 million in increased state general fund dollars related to caseload adjustments. The legislature spent a significant amount of time on the KDAD's budget this year, and I think really an awareness on the part of both the governor and the legislature that as the state begins to recover, from what's been a really, really difficult time financially over the last several years, that it was time to place some effort and focus on some of the human service needs that maybe have not been, that have maybe not gotten the resources that are that we all know are really important across all of these systems. So I'm going to talk about a number of items that were recommended either by the governor or by the legislature. The legislature recommended a 1% increase in reimbursement rates for nursing facilities in Kansas, about $7 million all funds for the coming fiscal year. Likewise, in terms of rate increases, a 1.5% increase in reimbursement rates in the Medicaid HCBS waivers, in the 7 waivers. That's about $10 million all funds. A significant item, and I would really credit advocates for really, I think, a really extended focus on a single issue and really coming together to really advocate for an increase in the protected income level. And I think, again, kudos are to those of you in the room and others across the state who really recognize the importance of this. The protected income level, has not been increased since a long time, a long, long time. And so this action recommended by the legislature, signed by the governor, increases the protected income level from $747 a month to $1,177 per month, which is about 150% of SSI. A little bit different than that, but pretty close to that. This will apply to individuals on the home and community-based service waivers and also the PACE program. This is really a significant quality of life issue for individuals across the state, and for individuals with disabilities, for the elderly, to really be able to, to retain more income. Again, significant impact on quality of life. So again, I feel like this is really one of the most significant actions that happened during the legislative session. This will be permanent. Questions kind of come up. This was in an appropriations bills for 1 year. This will be a permanent change in the protected income level. A few other adjustments in the budget process for KDADS as a whole. Additional funding of $5 million to community mental health centers for community mental health center grants. I think, again, kind of the continuing restoration of past reductions in mental health center grants. The legislature also approved some funding to be directed towards waiting lists for individuals on the intellectual and developmental disabilities waiver and individuals on the waiver for persons with physical disabilities. $5 million all funds directed towards the IDD waiver. Just about $1 million directed towards the PD waiver. That funding in and of itself will allow about 100 persons to move off the IDD waiting list and 55 to move off the PD wait list. Now you'll hear later when Commissioner Penrod talks about some of our priorities that we have a little bit more room based on spending on the PD side to have more impact even than that appropriation. And another recommendation that's included in the fiscal year 20 budget is an increase of $500,000 from the state general fund for alcohol and substance abuse services. This is really targeted for individuals not eligible for Medicaid services, and this has been an area that's been really underfunded as long as I can remember. And again, so a small amount, but again, some impact in terms of addressing those issues of individuals who don't have Medicaid coverage and have need for addiction services. You know, the next item is a little bit of kind of inside baseball related to some things the state is doing around IT services, $30,000 related to some IT modernization. And then one of the items included in the governor's recommendation is really a rebasing of reimbursement rates within the PACE program. It's required that we do this federally. This is an increase of $6.8 million for the PACE program, just over $3 million from the state general fund. And then for the state employees in the room or on the phone, I think folks were really glad to see a 2.5% salary increase authorized really for the first time in many years. So that's a quick summary of the budget changes to KDADS as a whole. I think before I take questions, I'm going to talk about the legislative provisos, some of those directives, and then I'll stop for questions on KDADS before I move to the state hospitals. So there were a number of provisions that were put into appropriations bills. You know, sometimes the legislature will write something into an appropriations bill and tell us to spend money to do a certain thing. It's really a way to give a directive to an agency for maybe a priority that the legislature has. And those are called provisos. We also had some directives that were just written into some committee reports. The first proviso relates to the traumatic brain injury program, and really a proviso directing us to increase the unduplicated waiver slot count to 723, lower the waiver's entry age to birth, and add acquired brain injuries to the waiver. This proviso was added in both fiscal years. You know, the issue of the unduplicated waiver slot count had to do with the way we had submitted our brain injury renewal application. And so, again, that really was not an issue. We were happy to make that change. The larger context is, and really the good news that Commissioner Penrod will talk about more is that, I mean, we're very close to the traumatic brain injury waiver becoming the brain injury waiver and covering acquired brain injuries in addition to traumatic brain injuries. So, I mean, we're very close to that happening. And she can give you a little bit more updates on timing as it relates to that waiver. Another proviso that I think is of importance is a directive that we seek a waiver from the IMD exclusion. That was also put in for both fiscal years. So we'll be working on that for submission to CMS by January. For those of you who don't know, the IMD exclusion, that's kind of some old vernacular that stands for Institute for Mental Disease. Ever since the time that Medicaid and Medicare became law in the 1960s, there have been exclusions of paying for mental health services in certain size facilities for adults, for persons aged 21 to 64. And actually originally it included children, and that got changed a few years ago. That means whether we're talking about our state hospitals, whether we're talking about NFMHs, whether we're talking about some other larger facilities that might be out there in communities. So this is really, really significant. I mean, it's a huge barrier. And so we're actually really excited to do this. The state applied for this a couple years ago, and it was turned down. We're in the process right now of implementing, working with CMS on the IMD exclusion for substance use disorders. So this will go beyond that. And so I think we're hopeful. We'll be working actively on that with stakeholders, and we think it really provides a lot of opportunity to bring in new Medicaid funding and really provide some additional resources around some of our critical needs in behavioral health. Another directive that was, and I think this last one I talked about was actually included within the KDHE part of the budget because they're the state Medicaid agency, and so is this next one. We've also been asked through KDHE, but we'll take the lead on this, working in partnership with them, to do a study of the costs and reimbursement rates for behavioral health services in the state, mental health and substance use disorders. And to report back to the legislature next year on that. And actually, the way the provisos are written, it looks like we'd be asked to report back twice in 2020 and in 2021. We'll see how that goes. But, I mean, we'll be working on that report. We did get a lot of directives from the legislature through these provisos. But you'll see we do have a few other action items on our priority list beyond the legislative directives when we get to those. So another proviso included in the KDHE budget that's relevant to us is some language requiring the Medicaid managed care organizations to provide updates to the Bob Bethel Oversight Committee related to psychiatric residential treatment facilities and waiting lists. That's been a big issue for a couple years, and kind of, from both hats I wear at KDADS and DCF, that's an important issue in terms of access to psychiatric services for youth. So that was also in 2 years. And then also for KDADS, there was one directive included within the Budget Committee reports asking us to examine and explore ways to decrease the waiting list for services, again, on the IDD waiver and the PD waiver. And so, again, we'll be working and talking with stakeholders and really in the context of waiver renewals as well about this issue. So I think before I talk about the piece of legislation, I think I'll ask if there's any questions in the room about the budget recommendations, anything you need clarity on. Yes?
I have a question about the protected income level. You said it's permanent. Is the 150% permanent, or is the number 1,177?
It's a dollar amount. And I would say, too, I think one of the, policy issues that I think many folks will be talking about in coming years, and that I know the governor has talked about in her past legislative life is, whether or not we could find some ways maybe to link that to a standard so that one wouldn't have to come back every 5 or 10 years and say let's increase this, but maybe some automatic way to do that. This doesn't do that. I mean, this makes that jump up to almost 150%, but it's the dollar amount that's actually in the proviso. Yeah, the question was about the protected income level and whether or not it was 150% or the dollar amount. And as you heard, my answer was the dollar amount. All right, also in the back. So the question now is, when does the protected income level take effect? We've been talking closely with our counterparts at the Kansas Department for Health and Environment And they're working actively to make this effective as soon as possible. There had been some dialogue earlier that it might take until as long as January. That will not be the case. The systems changes that the agency thought might need to happen, they have found a way to manage that. So the only delays have to do with some pieces with CMS, some process pieces, and I think in talking with the Medicaid folks, I mean, clearly closer to July than January, and I think their hope would be within a couple months. I think in the front.
A question about the waiting list. This past year, there was enough dollars allocated to that to take off 0.2% on the waiting list, and for parents that we represent, that's just, it's still an 8-year wait. Comment on it?
The question has to do with the waiting list for the intellectual and developmental disability waiver, and the fact that a year ago some funding was appropriated, and I think the calculation, the person asking the question was that it was 0.2% of the waiver waiting list, and I have no doubt that may be the case. The waiting lists are too long. I think I understand that. I think the governor understands that. I think the legislature understands that. I think we have to find some ways to work together to look at how do we best provide services. I want to be realistic in terms of the resources that are available in the state, and the amount of money that it would take to clear that waiting list. That is a significant amount of resources. I don't recall what those numbers are, but many millions of dollars. So that will continue to be a priority for ours. We will continue to prioritize being able to make movement there, but I also want us to maybe think more creatively about ways we might be able to make sure that individuals have access to some services, even if they don't have access to that entire waiting list. So again, I mean, kind of stay posted for just more opportunities for stakeholder conversation. I've been around these systems a long time, and I would sure like to leave this job in however many years that is, 3 years, 7 years, sometime, with someone sitting in that audience not having the same question you have. It is a very important issue to me, and I understand the position of, I understand what it, I don't understand what it feels like to be a parent, but I've talked to a lot of parents over the years with concerns about that. So.
Well, and the other thing is, even if there were money, we don't have the providers. How to lose money, taking a lot of people off the waiting list. So it's we're going backwards.
I mean, the rest of the conversation really had to do with some of the issues to do with reimbursement rates, and I think also some of the workforce challenges we have in the state. And we're not alone in Kansas, gosh, and I can't talk about any system today without issues around workforce challenges. That's an important priority, I think, for all of us. There aren't any easy answers to that, which is why I just think we have to figure out some ways, though, to have. Don't hear me that I don't believe it's important to add new resources. It's very important to add new resources. I think it's also important to figure out ways to have some new conversations, ways to think of some new ideas that might help us to address some of the issues that are out there. So, thank you. Other questions in the room? Any questions from, while folks in the room are thinking, any questions from folks who are on Adobe? Okay. All right. They're talking to each other. I think I'll keep moving then. And there may be a point where I open up the conference line, but I want to make sure we can get through this information. Before we move to the state hospital budgets, I did want to mention one piece of legislation that passed this session related to nursing facility receiverships. And this would be Senate Bill 15. I think as many people in the room know, 22 adult care homes have come into receivership. KDAD's taken 22 adult care homes into receivership due to insolvency issues or life-threatening or endangering conditions that exist at those facilities. In many cases, those facilities were in serious jeopardy of losing access to critical vendors, food, durable medical supplies, and the like, because they simply had no cash. Many didn't have funds to cover upcoming payrolls. Staff payroll checks had bounced. And then also, some really bad operators, doing some really egregious things like taking money out of trust funds, leaving residents with a negative balance. So we aggressively looked to amend the adult care home statutes this year. So and we got really tremendous support from the legislature. We were a little late in the process introducing that. I don't think I've ever seen a piece of legislation get through the process as quickly as this one did. So this would allow increased scrutiny of initial applications and any change of ownership processes. It would ban folks for 10 years from obtaining an adult care license after a receivership action. It adds some language that defines insolvency, which gives us some new tools. And it amends the receiver's powers and duties. I'm not going to read through all of this, but it certainly ensures that receivership funds are used directly or indirectly to protect the residents in those facilities. So again, pretty comprehensive. A little bit complicated statute, but it puts us in a much better position at the front end to have more information about folks who might be coming in and asking for a license, and then give some new tools at times where we may see some issues out there. State hospital budget adjustments, I'll spend just a few minutes on this. You'll see some like items across several of the state hospitals where we requested some additional funding due to some revenue shortfalls at the hospital in their Title 19 funds and disproportionate share funds. K&I received little over $800,000 in both fiscal years to cover that revenue shortfall and also to reduce the hospital shrinkage rate a little bit. And that kind of sounds like a technical thing, but it's kind of an important thing because it has to do with how many staff you can actually have working there in terms of care of individuals there. Larned State Hospital, again, some similar pieces in terms of $250,000 from the State General Fund to reduce shrinkage, about $600,000 related to a shortfall in disproportionate share hospital funds. Federal revenue was less than had been anticipated. The hospital also got a small amount from what's called the State Institutions Building Fund to address an issue to do with power supply to make sure there wouldn't be loss of power. Those were in the current year. In the upcoming fiscal year, you'll see similar items to do with shrinkage and the same shortfall in disproportionate share revenue. For Larned, the legislature also put in just under $200,000 State General Fund for salary adjustments to reduce turnover and the number of vacant positions. One of the issues we really face on the grounds of Larned State Hospital is some of the competition with the Department of Corrections, and we have some challenges at Larned, in terms of workforce, as you've talked about workforce as well. And so, again, some recognition by the legislature to begin to try to make at least some small progress on that issue. They've also asked us to report back on what impact there is and what else we might need in future years. Another specific recommendation at Larned was funding for 9 new safety and security officers and funding for staff to have personal protective devices. So, again, about $567,000. At Osawatomie State Hospital and Adair Acute Care in the current fiscal year, again, the same issue, shortfalls in revenue, some additional funding to reduce shrinkage, and then funding in anticipation of disproportionate share shortfall revenues. Same story in fiscal year 2020. And then at Parsons State Hospital, a similar issue as well. Some funding for a revenue shortfall, and then also some funding to reduce shrinkage and allow filling of a few more positions at that hospital. Before we take questions on the state hospitals, I'll also talk about a couple of the provisos that were added related to the hospitals. I mentioned the one at Larned State Hospital. We've been asked to report back on the impact of those salary adjustments on vacancy and turnover rates. And then at Osawatomie State Hospital, I might pause and highlight this a little bit more comprehensively. The legislature has asked us, and this was kind of already on the list for us. I think as I walk back in after several years gone, sort of the situation at Osawatomie, the moratorium of beds, just the unsustainability of that over the long term was pretty high in my mind. So the legislature added language directing the agency to create a comprehensive plan to end the moratorium at Osawatomie State Hospital. And to report that plan by next January back to a number of different legislative committees. And you'll hear about that as well when we talk about some of the priorities on our list. And I think it intersects, with the conversations about the IMD exclusion. It intersects with conversations about regional bed. Intersects with a lot of different pieces that are on our priority list. So I'll stop for questions on the state hospitals, and after that, we'll have our commissioners share with you kind of the key priorities that we see in front of us for each commission before we get your input. But questions on the state hospital budget pieces? Not seeing any in the room. Anything from folks on Adobe?
Not yet.
Okay. All right. Well, then I think we might shift gears. As I look around this room, I know an awful lot of you follow that legislative process closely. So probably what I've said so far, you already knew most of that, but which is partly also why I wanted to make sure that we not only talked about what happened in the legislature, but we begin doing some strategic thinking and planning and getting some input from you. So commission priorities. We're going to have each commissioner just spend a few minutes talking about maybe the top 3 or 4 priorities within their commission. There's lots of other things on the work plan, as they tell me each day when I say, what about this? What about this? But then these priorities, they didn't come from kind of folks sitting in this building and coming up with those. I mean, they came from, priorities that I brought in, that Deputy Secretary DeBoer brought in, priorities of the governor, priorities of the legislature, and probably most significantly, just from the work that we do all the time, with all of you and the interactions with all of you. And so I hope you will recognize some of those priorities. Before I turn it over to the first commissioner, I did want to spend just a minute for folks who may not know our organizational structure as well, to just let you know what those commissions are, and also a change we had made a couple of months ago. So KDADS currently has 5 commissions. The first is the Aging and Disability Community Services and Programs Commission. This used to be 2 commissions, an Aging Commission and Community Services, Disability Community Services Commission. I don't have those names right, I know. We merged those a couple of months ago under the leadership of Commissioner Penrod. The second commission we have is the Behavioral Health Commission. The third, Finance and Information Services, and probably most significantly, the commission responsible around nursing facility rate setting from a programmatic perspective. We have a new commission that we just created, and gosh, when did we launch that? Just maybe 3 weeks ago, something like that. 3 weeks ago, a state hospitals commission. And Kim Lynch, our former general counsel, is the new commissioner for the State Hospitals Commission. And this is something I've kind of felt like was important for a number of years, just the level of attention and issues that happen within our state facilities. One, I think merit that focus, but 2, I think the ability to target specific resources towards that rather than that taking up so much time of everyone in KDADS. I think when I walked in, it seemed like state hospital, state hospital, state hospital. Really, really important, but we have really, really big, large community systems, and I think this provides a way to provide the state hospitals the attention that they need, while also ensuring that we're really using our resources appropriately along the community services. And that'll free up Commissioner Brown with behavioral health and Commissioner Penrod as well from the time that they've spent connected to the state hospitals. Last commission, survey, cert, and credentialing. So those are the 5. So I'm going to turn this over first to Commissioner Amy Penrod, the Commissioner for the Aging and Disability Community Services and Programs Commission.
Hi, good afternoon. As Secretary Howard said, my name is Amy Penrod, and I'm the Commissioner for the Aging and Disability Community Services and Programs Commission. It's going to take me a little bit to get that right routinely. I wanted to go over with you a few of our agency commission priorities. First, I'd like to say that our commission really focuses on the social determinants of health involving housing, safety, nutrition, employment, education, and family and caregiver supports. And so to that end, we've identified, on the slide, we've identified our top 5, but rest assured there are many, many, many more things we will be working on in the upcoming months and year. The first priority we have are the HCBS waiver renewals and amendments. As you may know, the state has 4 of its home and community-based service waivers that are up for renewal in 2019. Those are the brain injury waiver, the intellectual and developmental disability waiver, the frail elderly waiver, and the physical disability waiver. Those renewals are in various stages of progress, and you may have seen just this week we announced our intention to re-engage with stakeholders, form some small work groups to go over some of the concerns that were raised during the public comment periods for the waiver submissions, revisit the major areas of concern that folks had, and get some feedback on what we can do to ensure that the waivers that we submit to CMS for approval are truly reflective of Kansas values that have been long held around home and community-based services. So there will be a lot of outreach here in the next month and a half to contact folks and get some small group work going and get some additional feedback for that. Our second highest priority, and this is we've got some short-term work and we've got a lot of long-term work to go, surrounds the final settings rule. We are launching some educational opportunities for providers and really anybody who might be interested this summer. We are working as a group to ensure that folks know what the final settings rule says or requires, where Kansas is right now with its compliance, and what we need to do to get to the end goal, and what that looks like. So some of that work will be kicking off this summer with some meetings, public meetings in July, and then that will be ongoing work for the next probably at least 2 years to get us into compliance with those federal rules. The next item I wanted to mention surrounds eligibility, and it involves developing provisional plans of care. And to explain that a little bit, we've recently been notified by CMS that in order to process eligibility for home and community-based service waivers as quickly as possible, we really were kind of missing one component of that whole process. So there's financial eligibility, there's functional eligibility, and then we should have had a plan of care. So we are working with our assessing entities to ensure that a provisional plan of care or a temporary plan of care is available at the time of the assessment, so that individuals for example, SED waiver, severe emotional disturbance waiver children can be given the access to waiver services as quickly as possible. So we'd have all those components ready to go as quickly as we can. And there'll be more information about that and how it affects each individual waiver as time moves on. I think our focus in the short term is the SED waiver and the TA waiver, and then we'll be rolling the other waivers into that process further down the road. Finally, let's see, 2 more items. The physical disability waiver offers. So as Secretary Howard mentioned, the legislature appropriated additional funding to add some folks to the PD waiver. That's about 55 individuals. However, we do have some additional funding that has not been spent yet that we are going to make some additional offers. So my belabored way of saying we'll be really busy here in the next couple of months making a significant number, probably at least 400 or 500 offers for the PD waiver. And then finally, the last item is the 1115 physical disability and serious mental illness work opportunity. And this is part of the overall CanCare waiver. This will give my commission with Community Service and Programs an opportunity to work with Commissioner Brown with Behavioral Health, as well as our counterparts at KDHE, to develop a project or promote work opportunities for individuals while still offering those core services to folks so they can feel secure in taking that job and taking advantage of those work opportunities and not risk some of their key services. Let's see. I think I covered everything. I will step aside for the next person and be available for questions in a little bit. Thank you.
All right, our next presenter will be Andy Brown, our Commissioner for the Behavioral Health Commission.
Hello, everyone. My name is Andy Brown. I'm the Commissioner for Behavioral Health Services, and I kind of wanted to just start it by saying that I'm sort of a prevention guy. That's where my background's at, and so social determinants of health is something that I believe pretty strongly in, and I'm proud to say that BHS is fairly heavily invested in programs that work around those areas. So, from our PATH program, our CIT program, our partners with the CMHCs working on things like mental health first aid, our supported employment programs, and partners like NAMI and Keys for networking. We're providing a lot of these services in communities around the state. And we rely a lot on our local partners in those communities to deliver those services in a quality manner, and I really appreciate the work that they do. Our top priorities in BHS for this year are we're going to be working on the Medicaid SUD exclusion waiver implementation. Currently, the implementation plan is in progress of approval. So as soon as that is approved, we will be able to begin with the implementation itself, which will involve a lot of stakeholder meetings and about a 24-month time frame for a rollout of all of those different services, some happening earlier in the 12-month range and others later in 24 months. The mental health waiver application, we applied for that last year and did not get approval for it. We will be applying for it again this year. So that'll be coming up over the next 6 months as we work on that project. The mental health task force recommendations is our second priority. And those of you that are familiar with it recognize that there are a lot of recommendations in that report, and we are invested in trying to make progress on those. We're going to be holding a meeting on July 9th to work with members of the task force to sort of review where we are at in terms of progress on those recommendations and kind of where we stand at the end of the legislative session. as these recommendations were made to the legislature as well as the agencies. And then the third priority really is the infrastructure implementation. So as the Secretary was mentioning, we have a lot of infrastructure issues around the state that we have been struggling to try to improve. And behavioral health services is one of those areas where we have a lot of room to make improvement. And we want to do more than just plan. We want to actually see some implementation of those infrastructure developments. So that's one of the things that we'll be focused on over the next several months is how do we actually roll out some additional infrastructure support around the state. And then I will pass to our next commissioner.
All right, our next commission is Finance and Information Services, where nursing facility rate setting lies. Commissioner Ridley's not here today, so Deputy Secretary DeVore is going to talk about the priorities for this commission.
Good afternoon, everyone. Well, I thought it might get warmer in here, but it has not, from my perspective. So I continue to freeze, but that's okay. On Brad's behalf, let me just simply share with you what we denoted as top priorities in the rate setting business, if you will, for nursing facilities. For one thing, we want to get some focus again on the care level 1 and care level 2 processes. As probably most of you know, there is a federal requirement called PASSAR that says anybody who's knocking on the door of a nursing facility must first be screened for mental health and IDD issues and concerns. If that individual triggers one of those priorities, then there's a second level of evaluation, and then that evaluation has to be determined then by the state whether or not nursing facility is appropriate for that person. The process has been around for years, but we want to make it a priority once again, and strengthen those two processes a bit more than we've had in the last few years. So we're excited about those opportunities. I also think it will give this agency, again, an opportunity between Amy's commission and Andy's commission, along with Brad's commission, to say, what does a PASSAR screen really say and do? And how do we make sure if someone does indeed go into a nursing facility, we've got specialized services to meet their needs. So that is going to be a priority as we continue to focus on community-based services. And then the exclusion, I think we've talked about that on several times already, but the mental health exclusion is, I think the Secretary mentioned, we do have 10 NFMHs around our state. So we want to make sure we're working closely with those NFMHs as we think about this mental health IMD exclusion. And then the resource utilization group impact, that's just a process in the nursing facility world for those of us who are geeks when it comes to this kind of stuff. The resource utilization group just attempts to measure the acuity level of individuals in nursing facilities, and we've actually attached that acuity level process to our rate setting. And the feds have indicated they might be reviewing some of that RUG option, so it may impact us. So it'll be a priority for Brad and his team. So I think that's it for me, Secretary.
Thank you, Janice. Our next presenter will be Patty Brown, our Commissioner for Survey Certification and Credentialing. Kind of speaking of geeking out, if you like regulations, you'll like what Patty has to say.
Thank you.
How do I follow that?
My name is Patty Brown, and I am the Commissioner of Survey Certification and Credentialing. And she's correct. Our job is all based on rules. We look at regulations, we write regulations, we enforce regulations. So all of the programs sort of feed into providers that then we deal with from the regulatory side. So one of our top priorities, Secretary Howard mentioned the legislation that was just passed related to some changes in nursing facility change of ownership and receivership regulations. So one of our top priorities is getting the regulations to support that statute written and in effect. We have already initiated some changes in the licensure and change of ownership application piece so that those requirements are already being implemented, but we do have some work to do on the regulatory side to make the regulations match the language of the new statute. The second priority is one that's really a carryover from the end of last year. We had several discussions with the IDD providers and the CDDOs about doing some more face-to-face communication about how the whole licensing process works with IDD. Through a lot of changes and transitions that took place, that kind of kept getting pushed back. We do have a goal of hoping to have that available by late summer. We have a new individual who is the manager of that section. We're working together to get that process started. So just for those of you in that population to know that we haven't forgotten, it still is there and is one of our top priorities. Related to that, for the past several years, we have been working with some guidelines related to shared living, that every year we were going to get regulations written, and every year the guidelines continue to be guidelines. So we have really moved up the emphasis on that and hope again to have at least a draft and a kind of a skeleton built so that we can begin to put together some work groups to flesh those regulations out and flesh that process out so we have something that everyone can work with through that process. Psychiatric residential treatment facilities. Again, Secretary Howard talked about the legislative thank you. The legislative focus, the legislative process of trying to expand that. In looking at that, we looked at our regulations, which we have a kind of conglomerate set. For those of you who are familiar with that area, we have standards, we have regulations, we have federal guidance because they are required to be federally certified. So again, we're putting together that skeleton. We'll be pulling those PRTF providers together to help create and finalize that process so that everyone knows what the clear expectations are. And finally, the last set of regulations that we are working on are the crisis intervention centers. That's an area where the legislation was passed. We still don't have specific regulations to work on. So yes, I am the regulation geek, and I actually enjoy it.
All right, our last and newest commission, the State Hospitals Commission. I'm going to turn this over to Kim Lynch to talk about priorities.
Good afternoon. My name is Kimberly Lynch. I am the Commissioner for the State Hospitals Commission. And as the Secretary said, we just launched on June 2nd, so we're just starting out and coming up with some of these core ideas. And so some of the main priorities that we have focused around, there's a number of bullet points there. One of the main ones that we would like to focus on right from the get-go is mobile competency. This is an issue that would relate to more the forensic side of the State Hospital Commission. There are a number of evaluations that take place either at the Osawatomie State Hospital or primarily at the Larned State Hospital. What we hope to do with the mobile competency is to be able to ease the strain on the Larned State Hospital, and specifically there's a wait list to receive these services, and sometimes it can get a bit lengthy, up to 3 to 4 months. And so what we're hoping to do is to make pretty quickly a pretty big dent to that wait list. There are some evaluations that have to be done at the state hospital just due to the nature of the evaluation, but then there are others that can be done in the community. And we do have community partners that help us with this right now. So the CMHCs do quite a bit of help with this, and they're often these are all the time they're court ordered, these evaluations. So they can be court ordered to a community mental health center, and an individual can do those there, or they may be ordered to either Larned or Osawatomie State Hospital. What we're hoping to do is add in another tier here to where we have some folks that can travel to the individual. So especially in rural communities and other areas, what becomes a crisis is these individuals have to be transported from their local community to either one of those two catchment areas. And that can become pretty lucrative and expensive for the communities. It could be expensive for those counties and for the sheriffs. And so what we hope to do is to be able to ease the strain on this system by bringing bringing those clinicians to the individual. So to be able to go to the jails, to be able to go to the hospitals, to be able to go to these individuals and perform those basic evaluations, it would be the KSA 3302 evaluations. So that's one thing that we'd like to do fairly quickly and get a plan in place for that. Second thing you'll see, and I will say a lot of the things that I have echo what Commissioner Brown has already talked about. He and I will be working closely together with the Behavioral Health Services because a lot of things that we do work together. The community piece is a really important part of the state hospital piece. So you'll see that we're looking to add a plan to add regional beds, and Commissioner Brown and I will both be working on that to see what can't be done in the community. There's been a lot of talk of regional beds over the past couple of years, and we want to start seeing those things come to fruition. So that would be gaining the budget for those, new RFPs or requests for proposals that may go out related to that area, seeing what providers may want to do in that area, and really developing a plan. That could be for care and treatment, so it would be the psychiatric beds, but it also will affect forensics. We would hope to see if there could be some restoration beds that could happen in the community as well. That might also ease the strain on the wait list that's at Larned State Hospital. The next thing you'll see is a plan to end the moratorium at Osawatomie State Hospital. The Secretary talked about the proviso, and there was a proviso that directs us to look at that issue. It's an issue that is just current on everyone's mind, and it's time. It's really time to lift that moratorium. So we want to work together to come with the stakeholders, with providers, with the CMHCs to come up with a comprehensive plan to lift it, and pretty quickly. That's one thing that's a top priority, is to be able to look at how we can do that safely. And then expand OSH certification. So as many of you know, there's the ADARE acute care. There are 60 beds that are certified with the Centers for Medicare and Medicaid Services. One thing we immediately want to do is look to see what can be done to add beds. And so that there's a number of ways that might happen. And mainly that might be looking either at renovating parts of the hospital and seeing what can't be done to where we can add additional certified beds. There are 166 beds total at Osawatomie, but only 60 are certified. So we'd like to see pretty quickly how we can get some additional ones certified and get a comprehensive plan in place to do that. The next thing you'll see is the plan to enact recommendations from the Mental Health Task Force. Again, Commissioner Brown and I will both be looking at this issue from both aspects, the community aspect and then the state hospital aspect. There were many points on that Mental Health Task Force report that do affect the state hospitals, and part of that is just adding beds within the community, whether that be through regional beds or, as the Secretary was saying, other ideas that may come to fruition that would help us to add to the continuum of health in the community. The next thing you'll see there is updates to the Care and Treatment Act. This is an act that has existed for a long time and hasn't really been looked at in a number of years. And with the changes that are happening, specifically with the moratorium and some other things that are happening, it's time to look at this act again and see if there are some things that can be done to update it. And so I want to say here, this is one thing where, again, we want to work very closely with community partners, very closely with the center or the CMHCs, to see what can't be done and areas that we might be able to either add or amend this. One thing we did recently, I think it was either in the last legislative session or the one before, is that we did open up one statute. It used to be that only Larned State Hospital could do certain evaluations, and we opened that up to where now Osawatomie can do some of those. And then eventually, if we get regional beds and these other opportunities like mobile competency, they can do some of those evaluations. So things like that. Are there some things that we can do with this act that might make it easier? As community services have expanded and come along, and it's time to update the act to match what we're already doing in the state of Kansas and what we want to do. And then the very last thing is we're assessing laws related to competency with either intellectual and developmental disabilities or other organic disorders. There's a judicial committee that actually begins tomorrow that's going to be looking at this issue and how the state of Kansas views competency as it relates to individuals who have an intellectual or a developmental disability. I think this is a really important review just to see what the nationwide trend is and how folks are handling individuals that maybe commit a crime that have either an intellectual or developmental disability, and see if typically right now they often may end up in one of the state hospitals, and if that's the best place for individuals to be, if that's the best fit, or if there might be some other options and possibilities. So we want to look at those laws to see what's fair and what's right in that area. And so those are some of the things that we have in store. Thank you.
Thanks, Cam. I hope in some of those priorities that you heard, I hope you heard action. I think one of the things that's really, really important to me is that we make progress on issues. I think I went to work at SRS for the first time in 1997, and I think it was probably 2000 to 2005 that I was probably most focused on issues that relate to this agency in a deputy secretary role at that time. And it's really interesting to me the number of issues and topics that we're talking about, that we've been talking about for a long time, not just for 6 years, 7 years, 8 years, but for 15 or 20 years. And I firmly believe that people who are committed to making progress, who have the right values and ends in minds, can do that. Folks hear me often say, how might we? How might we do that? We can break down barriers. We can make progress. Maybe we can't solve everything, but we can certainly make progress and leave things in a better place than they are. And so I hope you heard that as you listen to each of the commissioners. Talking about having an actionable plan. Not just an idea, but how would we actually implement that? Moving from really ideas to action. We want to move now to first any questions that you have for the commissioners or for myself based on their presentations. I mean, really questions, and then after that we'll go to any comments you might have, anything you'd like us to be thinking about as priorities. But first, I want to make sure if there's just something you didn't understand, you need more information about. So, no, okay. You're in the next part. All right. Questions? Yes.
I have a question about whether there's an intersection between the IDB and the Behavioral Health Commission, because it turns out